Welcome to This Explainer. Today, we're tackling a topic that literally affects millions of women worldwide, yet somehow it's still shrouded in so much mystery and anxiety. We're talking about uterine fibroids. Over the next few minutes, we're going to completely demystify these growths, explore exactly how they impact fertility, and lay out your actual medical options. Let's get right into it. Here's our roadmap for today. First, what actually are uterine fibroids? Then we'll look at symptoms and risk factors. Third, we'll cover fibroids and your fertility. Fourth, diagnosis and medical treatments. And finally, surgical options and recurrence. Okay, let's dive into this. Section 1. What are uterine fibroids? Right off the bat, I want us to focus on the absolute most crucial word here, non-cancerous. Uterine fibroids, or if you want to use the medical term, leiomyomas, are benign growths that develop in or around the uterus, usually during a woman's childbearing years. I want to immediately lower any anxiety you might have right now. These are not cancer. They rarely spread anywhere else in the body. They just kind of vary in size and how fast they grow. And listen, if you have them, you are far from alone. Look at this. A really striking 20% of females in their reproductive years will develop fibroids. That's 1 in 5 women. If you've been diagnosed, hopefully this just validates how incredibly common this shared medical experience really is. Before we move on, we need to clear up a super common misconception. People mix up fibroids and cysts all the time, but they are entirely different things. Think of a uterine fibroid like a pebble, a solid, muscular growth. A uterine cyst, on the other hand, is much more like a tiny water balloon. It's a fluid-filled structure. Knowing this structural difference is absolutely key to understanding how they're treated later on. Moving on to Section 2, symptoms and risk factors. So why do these even grow in the first place? Well, the definitive cause is honestly a bit of a medical mystery, but research points strongly to a few specific triggers. First, think about your own family tree. If a woman in your family, like your mom or your sister, had fibroids, well, you're unfortunately genetically predisposed to them. Next up is hormones, specifically estrogen and progesterone. These are the hormones that stimulate the uterine lining every month, and they also stimulate fibroid growth. Other insulin-like growth factors play a role too, and statistically speaking, fibroids do occur more commonly in women who are overweight. And this brilliantly illustrates how the medical field classifies these growths. It's entirely based on real estate, basically where they sit in the uterine wall. Let's think of the uterus like a room. Intramural fibroids are the most common, and they grow inside the actual walls of the room. Submucosal fibroids actually bulge inward into the room itself, the uterine cavity. And finally, subserosal fibroids grow on the outside exterior of the house. Now remember those submucosal ones, the ones bulging inside? Keep those in mind because they're going to be very important when we talk about fertility. So what does having a fibroid actually feel like? Well, surprisingly, a lot of women are completely asymptomatic. They don't feel a thing. But for others, the physical toll can be incredibly disruptive. We're talking heavy, prolonged menstrual bleeding, frequent urination, and severe pelvic cramps. Because they literally take up physical space, they can press on your bowel, causing constipation, or even press on nerves, which causes this radiating leg and back pain. And in some extreme cases, a fibroid might even cause acute sudden pain if it grows so incredibly fast that it outgrows its own blood supply and essentially begins to die off. All right, Section 3. Fibroids and your fertility. Can fibroids cause infertility? This is probably the most common question and honestly the primary fear for couples who are experiencing difficulty conceiving. It's a really heavy question. So let's look directly at what the clinical data tells us. The short answer here is yes, but the why is what's truly important for us to understand. Remember those submucosal fibroids we talked about just a few moments ago, the ones projecting right into the uterine cavity? Well, because of that very specific location, they can literally distort the physical space inside the uterus. And this structural change can actively interfere with an embryo's ability to successfully implant into the uterine lining. This is exactly why fibroids are more frequently seen in women who have had difficulty conceiving in the past. Which brings us to Section 4, diagnosis and medical treatments. Because fibroids are so often these silent, stealthy guests, you really can't always rely on symptoms to know they're there. Catching them relies heavily on your regular checkups. Just a routine pelvic exam can often detect changes in the size and shape of the uterus. And if your doctor suspects something is up, that's when they'll bring in the high-tech tools. We're talking vaginal ultrasounds, CT scans, MRIs, or maybe a hysteroscopy. The goal here is to get a highly precise map of the size, the number, and the location of the fibroids, so they can formulate the best possible treatment plan for you. Once diagnosed, there is definitely no single one-size-fits-all approach. The treatment follows a very logical progression, and it's totally based on your age, your symptoms, and the fibroid itself. Step 1 is often just vigilant waiting. Remember, these are non-cancerous, and they usually grow very, very slowly. Actually, after menopause, when your hormone levels drop naturally, fibroids often just contract on their own. Now, step 2 involves medications. And to be clear, these won't magically eradicate the fibroids, but they do target the hormones regulating your cycle to help shrink them down and manage those tough symptoms like heavy bleeding. And then we have step 3, which is surgery. But that's really reserved for when symptoms are just too significant and disruptive.
And that leads us to Section 5, surgical options and recurrence.
So the crucial point here is this. If a woman plans to conceive in the future, a myomectomy is really the only surgical option. Unlike a hysterectomy, which removes the entire uterus altogether, a myomectomy is a highly targeted procedure. The surgeon goes in and specifically removes just the fibroids. They leave the uterus itself completely intact and right in place, which obviously preserves your reproductive capabilities. Now, there are 3 distinct surgical approaches for this, and it depends entirely on where your fibroids are hiding out. An abdominal myomectomy involves a traditional external incision to reach the fibroids growing on the outer surface. Then there's a laparoscopic myomectomy. This one is minimally invasive, using tiny little instruments through small incisions near the navel. And finally, a hysteroscopic myomectomy tackles those really tricky submucosal fibroids inside the cavity. They do this by going naturally through the cervix, meaning there are absolutely no external incisions at all. However, it is so vital that we have a complete, medically accurate picture before anyone makes any decisions. As our source directly states right here, all myomectomies affect future fertility and carry a risk of scarring and adhesions. Also, the procedure involves the risk of undue bleeding, which may necessitate a hysterectomy. We want to make sure we're impartially presenting these facts to you. It's crucial to understand that while surgery can absolutely be highly effective, it does come with severe inherent risks that you really must carefully weigh with your healthcare provider. And when we're managing long-term expectations, there's one critical number you need to keep in mind: 30%. That is the risk of fibroid recurrence over a 10-year period after a myomectomy. You see, because the uterus is preserved, the environment that grew the initial fibroids is still right there. So for patients who had multiple fibroids to begin with, there is a very real chance that new ones might develop down the road. Which brings us right to the end of our deep dive. You now possess a clear, structured understanding of what uterine fibroids are, exactly how they impact your body, and the logical progression of treatments available to you. The power is completely in your hands now. So I'm going to leave you with this question. Now that you understand the mechanics, the risks, and the actionable treatments for uterine fibroids, what proactive steps will you take in monitoring your own reproductive health journey? Talk to your doctor, ask the right questions, and stay curious. Thank you so much for joining me on this explainer.